Thank you for showing interest in our project entitled Factors Associated with Complicated Post-Operative Course After Norwood Operation. Hypoplastic left heart syndrome is a cardiac condition with high mortality. Low cardiac output state is a major determinant of survival in these patients. Various anatomical, demographic, and surgical factors may impact outcome of these patients post-Norwood operation. Therefore, it is crucial to identify low cardiac output state in order to mitigate the complications for improved post-operative outcomes. Being a major center providing care to single ventricle cardiac patients, it is paramount to have prompt markers to identify low cardiac output state, which then determines the success and outcome of these fragile patients. This study was done hoping to predict the complicated course in post-Norwood patients with improvement of results in mind. This is a single-center retrospective observational study involving 30 hypoplastic left heart syndrome babies. 9 time points in the first 48 hours of PICU admission were analyzed. These data were then divided into complicated and uncomplicated course based on the need for extracorporeal support and the duration of invasive ventilation, whether it is 7 or more days or death. Linear regression analysis then was done to explore time trends and complicated course. It is interesting to note that vasoactive inotropic score, lactate, base excess, and VaCO2 gap shows significant association with complicated course. Higher vasoactive inotropic score seems to be a good discriminatory factor between complicated and uncomplicated outcomes at any point of time in the first 48 hours. Lactate seems to be higher in those with complicated outcomes, and it is a good marker up to the first 24 hours post-operative period. We know arterial CO2 gap only serves as a good marker up to the first 12 hours. Base excess also seem to be lower in those with complicated state. So with this study, we can conclude that vasoactive inotropic score, lactate, base excess, and VaCO2 gap up to the first 12 hours post-Norwood are strongly associated with complicated outcomes, and these can potentially be prognostic factors after Norwood operation. That's the end of my sharing. I'm happy to take any questions. Thank you.